I am Joseph Finkler. I'm an emergency physician, and COVID-19 has dramatically changed the practice of medicine in our hospital. Our department, I would say it's managed chaos. We see lots of people with mental health disorders, with substance use disorders, with poverty. COVID-19 changed everything. The messaging was, do not come to the emergency department unless you have a life and limb threatening problem or you're in real distress. Oh yeah, this was amazing actually. To be honest with you, I've never seen anything like it. One of the first things the hospital needed to do was increase its capacity for a possible surge in patients with respiratory illnesses. So, people were making huge changes in how things were going to flow in the department. And it required the cooperation from all levels of medical administration, and people were working in unison to get a handle on what was going on. And also they were scouring the literature and collaborating with people around the world to figure out what were the best practices to invoke to manage people with COVID-19. I don't know where I got it, but around the third week of March, I started feeling incredibly fatigued, as if I had a headwind behind me and somebody pulling me from behind by my coattails or with some sort of a harness. And I attributed this initially to working a long string of night shifts and then changing my time zone to working late afternoons and evenings. It was actually my grown children that said, Dad, I think you have COVID-19. You should get tested. I said, I don't have COVID-19. I just have a bronchitis. I was hoping I didn't have it because I didn't want to have to be sidelined and leave my colleagues to have to fill in the gaps from my shifts in this time of need. I have never missed an emergency shift because I was sick. The only time I took scheduled time off from the emergency department when I had joint replacement surgery, which was scheduled. And I think most of our colleagues are pretty hardy, and they'll work through their shifts, even if they feel a bit unwell. So I think all of us have this sort of team feeling that we don't want to let our colleagues down and have other people carry an extra burden. I think that's a fairly common sort of philosophy. Because I'm considered immune to COVID-19, and I've actually been tested and developed antibodies for that, is that I may be able to be the person more involved in those critical procedures where there's aerosolization of virus and increased chance of spread. So we had a little event there that happened a couple of weeks ago at the hospital. A patient came in, was stabbed, and was initially stable, then very rapidly deteriorated, almost like a hurricane. And so some of my colleagues were fully gowned in personal protective equipment, and I had a slightly lower level. I had a gown, a mask, eye shields and gloves, but did not have the full hazardous material suit on, and there was no time to waste. So they said, Joe, you go to the head of the bed, you'll be the one managing the airway because there's no time to waste. And we did it real quickly, and luckily the patient survived. Yeah, you know what? I'm super proud of our hospital. They've done an amazing job at preparing our hospital. I would say, and it hasn't happened, if our hospital gets blown over and overwhelmed with this pandemic, it won't be because people didn't try their hardest and use the best policies and practices. I think that what the pandemic has shown us that people can lock arms and work together and put aside either any grudges or any egos. I think that this is a great way to move forward. If we can do this for COVID-19, certainly we can do this for other illnesses like AIDS, diabetes, cancer. So I would think that there may be a better environment for collaboration in the future, you sharing best practices and knowledge. across all different sort of platforms. So I'm actually quite optimistic.